श्री अमर पटनायक जी, श्री अमर पटनायक जी।
So this is my maiden. Thank you so much. Sir, I'm basically a numbers person. I used to work with the CAG of India, so I'll start with numbers. The budget has only a provision of about 1% of the GDP on the health sector. So given that particular fact, when there is a 15% hike in the budget of AYUSH, it's actually a very welcome development. 1939.76 crore. Now in this, one has 40 crores for All India Institute of Ayurveda at Delhi and 50 crores for National Institute of Homeopathy at Kolkata. What's interesting, however, is that the AYUSH delivery system, the revised estimates had 101.86 crores, which has been brought down to 92.31 crore. When we are having several deliberations and detailed deliberations on the idea of expanding AYUSH, I really don't understand how the AYUSH delivery system budget provision has been decreased by about, though marginally, by about 10 crores. Now there has been provisions made as in 2018-19 in various schemes that were there before. It's basically continuing in 2019-20. But what I thought was interesting is the fact that experience of Kerala would suggest, I was a principal agent in Kerala, would suggest that AYUSH related naturopathy kind of practices have been merged seamlessly rather into the tourism sector. The medical tourism has come up in a big way in Kerala for a long period of time, whether in Kottakkal or in Shantigiri, in a beautiful way, and I have seen it myself, where foreigners, a number of foreign tourists come specifically to Kerala for a particular time during the year just for availing this particular treatment. So when it is actually being practiced in a particular, in Kerala in such a large way and in an institutionalized manner, I thought this is one thing which the budget has missed previously and even now. Now, I belong to Orissa. I have an interesting anecdote to say that very recently in this Rath Yatra which we had, just a few days before that, we have a function. The function is when the Lord comes outside and takes a bath. We call it as Snan Purnima. And because of that, he gets fever. And for 15 days, I think 11 days, 13 days, probably nobody can see the Lord because he is ill. Now, during this particular process, the Sevayats who are responsible for treating the Lord, they put various kinds of balms, all aspects, all relating to whether it is Ayurveda, whether it is Siddha, we really don't know, but I know for certain that it is not allopathy. Now, when the origin of the treatment of the Lord of the universe starts with a system which is there since long, I would suggest, and my demand for Orissa would be that we should have a university in Puri which takes into which basically integrates all the aspects of AYUSH in that particular training course. Here there have been deliberations where we have separate for each branches, and I'm sure as we go along that when in one particular pillar we are talking about integrated medicine system, and another particular system, a particular place we are talking about separate systems. I think there is no place in India where we have a university which teaches all aspects of the same AYUSH, all branches together to a particular student. So this is one aspect which could be considered by the government. Now, while making provisions is very fine, and I must also say that there are about 500 crores which has been made for Central Council for Research in Ayurveda, Homeopathy and Unani without really giving indications as to what would be the outputs. But interestingly, the 2017 Union Report of the CAG, number 12, and in various states like Delhi and Rajasthan, has brought out several issues which need to be considered. I am not really sure whether the current budget spending of 2,000 crores or about 2,000 crores would be able to, has been provisioned taking into account these aspects. For example, in several places there have been unutilized funds, blockage of funds. Example, I think Calcutta, the National Institute of Homeopathy. Staff shortages, shortages of doctors, nurses and pharmacists. Just now they said about the shortages in various places. No toilet facilities, low bed utilization, underutilization of equipment, improper storage of drugs, inadequate emergency services, essential diagnostics and operation theaters. And the mandatory quality check inspections not being done, which is very serious. So this is what the CAG report has been saying consistently in 2017 and 2018. The ministry in 2014-15 had been allocated about 1,069 crores, out of which 573.21 crores were surrendered due to non-approval. Numerous ambitious projects have been stuck due to lack of land resources. Amount of 25 crore had been allotted from the budget to set up the All India Institute of Unani, but the funds had to be returned completely due to non-approval. These were the CAG's observations. So we can have a lot of grandiose plans, we can have a very high budget, but all that really doesn't work if it doesn't get implemented in practice, and the number of doctors doesn't go up, the number of beds doesn't go up, the training of the doctors doesn't take place, the drugs are not stored properly, the drugs are not supplied properly and at the right time. I would not like to quote the CAG's report, which I intended to, but it can be referred to, which is at page 25 of the CAG report number 12 of 2018. Now I would like to come to a very serious issue about the questions that, the suggestions that were rather made by Sri Jairam Ramesh. The National Rural Health Mission, it had stated that one of the key mandates is mainstreaming AYUSH into the national health system, national health policy, because of the human resource shortages in the Indian healthcare, particularly in the allopathy sector. And this was planned at the primary level, at the secondary level, at the tertiary level, by co-locating the Ayurveda or the AYUSH doctors along with their allopathy counterparts. Now, the practical challenges, these are the practical challenges. The practical challenges are whether the broad philosophical orientation of each of the systems of medicine is distinct. Can you have allopathy philosophy, the philosophy that guides the allopathic drugs, administration of allopathy drugs as a profession, and the philosophy that guides the entire AYUSH, can they be combined? Can that philosophy be ever combined? Can you have a combined course first 3 years of this and then separate it out? No, it's not possible. Because the basic philosophy of allopathic system addresses symptoms and treatment of causes of illness based on a biomedical model understood with the help of epidemiological investigations. The Ayurveda system largely operates on a holistic approach to illness that balances the three doshas, namely Vata, Pitta and Kapha, and places health in the larger context of socio-economic, environmental and psychological situations. The basic philosophical foundations are different. This diversity makes it very important to keep in mind while integrating the systems. These are issues which are not very easy to handle. I can understand the problem of the people who would be working on this. It's not very easy to handle. This difference pertains not only to AYUSH, it also pertains to the different branches under AYUSH. The Siddha, the Ayurveda, the naturopathy, the homeopathy have different philosophical orientations. The philosophical divergent practices forced together without a common ground can mean chaos unless the systems are ready to evolve, gaining from their mutual strengths. So rather than trying to integrate in an artificial manner the philosophical bedrock of these different branches of AYUSH and allopathy, it would have been better probably when the practitioners sit down to decide what are their mutual strengths and weaknesses, as they say, probably a SWOT analysis, and try to reach a conclusion as to how to take it forward. There are also macro level, besides these macro level differences, there are also distinctions in the approach to specific illnesses. There have been various studies which have been done in which one has found in a case that a treatment which, a particular disease which required no treatment by an allopathic doctor was prescribed by a Siddha doctor and vice versa. These differences in approach in various areas of healthcare, such as chronic kidney diseases, cancer, diabetes, are well known. Now, this plurality of practice that arises in such integrated centers have to be kept in mind while doing this integration. There is a third point here. The current form, the Ayurveda and Siddha systems largely derive their knowledge base from traditional wisdom, not supported by a body of evidence as understood by the allopathy practitioners. Well taken. Though Ayurveda texts do prescribe several levels of evidence, they do not exactly match what the allopathy doctors want. They basically want randomized field trials. The randomized field trials can be debated as to whether it is, how good it is, how bad it is. But again, the method of evidence collection and their accumulation and interpretation are completely different. So one is a normative, evidence-based, another one is empirical approaches. There is a fourth point, a fourth issue which has to be addressed, and that is the cross-referral of patients. Cross-referral of patients, the National Commission on Macroeconomics and Health background paper in integrative medicine, it highlights some of these important illnesses where the AYUSH system, as some honorable member said, is better than the allopathy system. But this is tentative, it's not based on evidence. So it is very important that the practitioners of each of these branches within AYUSH and practitioners of AYUSH with the allopathy branches, they have to sit down. They have to sit down and discuss. And which are the particular diseases where the cross-reference of patients will be minimized. Because there have been several instances where a patient referred or initially under treatment under the AYUSH system goes to an allopathy doctor and says that you have been mistreated or you have been given a wrong treatment and there has been a failure of a kidney or failure of a heart or failure of a liver. So this cross-referencing is an issue which has to be addressed. And the lastly, as it was being discussed here, that whether you can have cross-practice. The Supreme Court has clearly said that cross-practice is prohibited. Wherever it is going on, it is illegal. The Common Review Mission of the NRHM have shown that AYUSH practitioners are practicing allopathy medicine in several states, including Uttar Pradesh, Chhattisgarh, and Bihar. But this is illegal. Now, if it is to be made legal, there has to be changes which has to be brought in the medical council's own declarations as to define who is a practitioner, and these exercises to be carried out. Now I'll come, lastly, to this point that what is the way forward? The way forward is at two levels. One is at the institutional level and other one is at the community level. At the institutional level, I would like to suggest that there has to be a clear role definitions of AYUSH practitioners and allopathy practitioners in the treatment of patients, in their mutual interactions, and in community accountability mechanisms that has to be specified. And it should include basically proper identification of allopathy and AYUSH practitioners by patients, understanding what is their limit, what is the restrictions on each other's professions, how much they can, how far they can go and how far they cannot go, they should restrict themselves. This has to be, and accountability for the same, this has to be specified. The second is very important, that is protocols for interaction and referrals between allopathy systems and AYUSH has to be established. And they have to be established after assessment of mutual strengths and weaknesses of both the professions, sitting down with each of the practitioners. The ongoing standardization and quality control of AYUSH treatments and procedures have to be strengthened. A strong traditional knowledge database and a strong evidence database for AYUSH, because both of them have different methods of collecting evidence and consolidating the same for interpretation, has to be established. An ethos of trust and mutual respect between AYUSH and allopathy practitioners has to be established, which is grossly lacking now. So all I want to say is that despite all the provisions that we make, the bulk of the provisions, the CAG says probably doesn't get spent, but more important is the philosophical issues behind integrating these two systems. I personally feel that Kerala is a good example where my personal experience has been that they have integrated to such an extent that the community has accepted it. This may not have happened elsewhere. Thank you so much, sir.
धन्यवाद अमर पटनायक जी, अपने पहले मेडन स्पीच में बहुत सकारात्मक और अच्छे सुझाव देने के लिए।